According to the American Diabetes Association, nearly 1 out of every 10 people in the greater Philadelphia area is affected by the disease. It takes a toll not only on patients, but the medical system too. And now one local hospital has found a way to ease that burden using artificial intelligence. NBC 10's Brenna Weick shows us how the technology is actually putting the humanity back in healthcare.
AI has been a game changer, and AI will continue to be a game changer in medicine.
Dr. Ben Slovis is Temple Health's Chief Information Officer. He's on the team tasked with figuring out how doctors can use technology to their benefit and their patients.
Really trying to get these tools to work for us, not against us.
Right now, Temple is the only hospital in Philadelphia using an AI program known as EndoTool, and the only hospital in the country administering it under the skin. It helps doctors manage diabetic patients' sugars better.
Low levels of sugar, and specifically severe hypoglycemia or very low blood sugar, can be deadly. And when you're hospitalized, management of your sugar is actually very difficult, especially if you're very ill or critically ill.
The computer keeps some important records, and nurses enter the other numbers it needs. Then
the tool adapts over time based on the algorithm to either increase or decrease the dose based upon the patient's response.
The results speak for themselves. Since using EndoTool, doctors at Temple have recorded a 2 to 3 times reduction in hypoglycemia rates. Now they hope to find ways diabetic patients can use it after they head home.
Okay, we've improved the diabetic management of patients in the hospital. How do we transition that out of the hospital?
Skeptics worry letting technology take over will lead to more mistakes. Dr. Slovis says only if it's not done right.
It's very reasonable and appropriate to approach AI with a level of skepticism. It's happened really fast.
It's about working with technology, not against it.
A human plus a computer is always better than a human alone. We are terrible at looking at 10,000 rows in a flow sheet and hoping that you can find that one nuance difference. Yeah. Computers are excellent at that.
And in some ways, he says AI is bringing doctors back to the heart of healthcare. Nowadays, hospitals all over are using AI to help them record patient interactions. That way, doctors can spend less time typing and more time interacting with you.
So technology is kind of getting us back to humanity.
Correct.
A huge factor in all of this is AI's impact on healthcare worker burnout. The technology they use to record patient interaction ends up saving doctors hours of time after their shift, meaning they have more time to do research, teach students, and spend time with their families. So it's a game changer for both doctors and patients. In North Philadelphia, Brenna Weick, NBC 10 News.